On the 29th of November, MOH was notified by our Australian counterparts under the WHO International Health Regulations framework that there were 2 confirmed COVID-19 cases that were diagnosed to have Omicron variant. They had traveled from Johannesburg in South Africa to Australia. They had transited through Singapore at Changi Airport. They did not leave the airport. They were only in the identified isolated transit area, which was meant for which was dedicated for use of these travelers for onward travel. So we have not assessed significant risk of infection coming in at this point in time into Singapore. These 2 travelers had some contact with other travelers, some of whom have traveled on to other countries, and we have informed the relevant health authorities to investigate and make sure that those travelers remain in good health. But for those who did come into Singapore in the same flight, we had in fact implemented, before news of these infected travelers from our Australian counterparts, we had already implemented a surveillance system for them, and 7 travelers coming into Singapore on that same flight were placed under enforced quarantine in our dedicated quarantine facility. They had to undergo on-arrival testing. All 7 tested negative, and they will continue to be tested on a regular basis, and only if they have a negative test will then they be allowed to exit the SHN that they are presently under. One of the 7 travelers was in fact within the 2-row normal formula that we use to identify potential close contacts on flights. And this particular individual has then been isolated away from everyone else, quarantined, and continues to be also on a regular enhanced testing regime. But all 7 of them tested negative on their arrival tests. They are all asymptomatic, and we continue to watch them closely to see whether they ultimately develop any features of infection or whether or not they ultimately will test positive.
Just to clarify, 7 of them entered Singapore, 6 go on SHN, 10 days, 1 close contact, go on quarantine. Yeah, so all this SHN quarantine sounds all very familiar because these are all the healthcare protocols that we used to adopt last year and early part of this year. So it's the same.